Hello, my name's Liz McGregor and I'll be doing two presentations on common ailments in horses. The first one deals with splints. Now here we've got two pictures of horse's leg. One shows the outside of the leg and you can see the splint outlined in red, and one shows an x-ray of the horse's legs which shows what's going on inside the leg when he actually throws a splint. This is your hippus, otherwise known as the dawn horse. And you might wonder what this little chap is doing in a presentation on splints. But he is actually the ancestor of our present day horse. And as he was a herbivore and didn't have an awful lot to fight with, he was quite a tasty morsel for all the predators that were around millions of years ago. And his only means of defence was to run. So he ran on the tip of one of his 5 toes. And here we have the evolution of the horse's foot. As he ran on the tip of his middle toe, the other toes became obsolete and gradually disappeared, finally leaving the one toe just there. This made it easier to carry a more muscular body and gave less skeletal weight below the knee, which made for a longer stride and greater speed to get away from whatever might be chasing him. And gradually he evolved into the one-hooved quadruped we know today as the horse. The splint bones are actually vestigial toes, and they're found either side of the cannon bone. Splint bones are otherwise known as the metacarpals. So what is a splint? It's a hard ossified little swelling somewhere between the third metacarpal, the cannon bone. This is a caudal view of a horse's limb, probably the front one. And there's your second metacarpal just on the edge there, and that's the medial splint bone, that's the inside splint bone. And that actually does quite a good job of helping to support the carpus or knee. And there's the lateral splint bone. As a horse gets older, the splint bones, which are attached to the cannon via the interosseous ligament, this becomes more ossified or bone-like, and they do actually fuse to the cannon bone. But that's not anything to worry about, it is quite normal. Splints are caused by damage to the interosseous ligament, and they tend to be quite common in young horses between the ages of about 2 and 5. Poor conformation can cause it, horse striking into itself with its front leg. Mineral imbalance in the diet, not enough calcium or phosphorus, excessive weight of horse or rider. You do a horse absolutely no favours by overfeeding it, and too heavy a rider on a horse that's not capable of carrying it won't do the horse any good either. Work on hard or uneven going, unbalanced feet, get the best farrier you can find. There are some cowboys out there and it's worth looking around for a good farrier. Stress, tight turns, perhaps performed at speed. Blind splints are usually due to movement of the second or fourth metacarpals, and they're more difficult to detect because there's often no outward swelling. They tend to show up on CT or MRI scans Sometimes it needs a nerve block to detect them. They can also impinge on the suspensory ligament, which runs just down there. False splints are due to direct trauma to a horse's leg, such as a kick or any other blow. Horses have been known to come in from the field with what appears to be a splint. Maybe a youngster has been messing around and he's knocked into himself with one of his own legs. It results anyway in what's known as a false splint, and it should be treated just like any other splint. Signs and symptoms. Well, there's going to be heat, swelling or edema. Injury is going to be warm. There's inflammation, and it may contain a hard bony swelling. Horse is lame to a greater or lesser degree, although the swelling does subside over time. Those are two x-rays of a horse's leg. You see the splint there and another one there. Detection, as I said before, injury on one or more limbs, reluctance to put weight on the limb, and suspected cases confirmed by MRI, scintigraphy scans. That is a MRI scan, and that's the transverse view of a horse's hind leg. There we are, that's his cannon bone. And that's quite a bad injury to a splint bone there. Treatment, management and prognosis. First thing you need to do is stop the work. If you work a horse with a splint, you're going to make it much worse because of the inflammation will be greater. Start cold horsing or cold packs straight away. These can be quite effective, especially in the first 24 to 48 hours. Boot will reduce the pain and any swelling which happens to be there. DMSO can be used to reduce inflammation, mixed with a little steroid. Acupuncture and homeopathy have also been tried, and there are a couple of old wives' tales out there. Some people advocate binding a cut lemon over the splint, others rubbing it with a turkey bone. Personally, I feel that if it's not going to hurt the horse, and it may do some good, it might be worth trying. The horse should regain full mobility over time and should be able to undertake his regular duties without distress. Splints aren't an unsoundness, they're more of a blemish, and they can sometimes spoil a show horse, and he can be put down the line because of it. The best thing to do is overhaul your management ideas and check the horse's legs every day. Employ a good farrier. Don't work youngsters too hard too soon, or indeed hammer any horse's legs on hard ground. If you feel it's necessary, turn him out in paddock boots. Make sure he's got a balanced diet. Make sure he's not too fat or too thin. Finally, if you've got any doubts at all, call your vet. What you think may be a splint might well be a fracture, and that could lead to an awful lot of complications. So call the vet. The horse deserves the best of care, and he would no doubt thank you for it. Thank you. That's the end of my first presentation.